I would always recommend a whole house filter if you can. Now, if you sometimes when that gets expensive, then they even just have like little things that go in the shower. Like even if it's a carbon filter, it's not perfect, but guess what? If you can remove at least 80% or 90%, and we're taking showers, again, skin number one organ, then yes. And most people will feel with any kind of house filter, their skin is a lot less itchy and dry because it's not getting that high, heavy chlorine and fluorides and all these other chemicals. And also the smell will be better. And also they notice, like, especially when they use a whole house filter, that their clothes and everything, there's less detergent they have to use because it's a softer water. I recommend not using water softeners that you have to add salt, like the old-fashioned ones that we all grew up with, the pellets and stuff. They now have ones that are made out of coconut shells and different kind of carbon and natural filters that soften the water without adding the salt. Because then when you add the salt, then people have to worry about blood pressure problems when they're drinking water.
So we just spoke about how to avoid getting some of these toxins into our body. But we've all been exposed to a wild amount of environmental toxins, from our food as well as from just living in this toxic world. How do you suggest we go about detoxifying ourselves?
Sure. So one of the things that we do when I see a patient, and again, we're open always to consultations, go to sanjevani.net, SANJEVANI.net, make an appointment. What we do is that we first test for the toxicity, right? Because if there's toxicity, then there's protocols of things doing naturally. But it's not just doing some kind of detox that most people think. You have to actually evaluate the patient's microbiome. Most people have some kind of intestinal increased permeability, leaky gut, or dysbiosis. If they have any of these gut imbalances, then if they were to do a detox before that's fixed, which most people do, it's actually more damaging because they're actually then grabbing the heavy metals or the toxic elements or nutrients, and actually goes back and it recycles in the body. This is the kind of complexity, but the nuance of having clinical practice than being a social media influencer. People are like, oh, let's do this detox. Okay. Now, what we want to do is that if you're eating plant-based, what you're doing is that you need to get to 30 grams of fiber or more a day in the diet, slowly over time, 5 grams per week to get there, right? Fiber is what helps bind to toxins, right? Then what we do is we measure, like on a nutrition test, we're measuring alpha pol, glutathione, other measurements of what helps with detox. We actually have on the test, it will measure detoxification markers biologically and biochemistry-wise. Everybody's unique. So even though we all eat maybe be plant-based, your detoxification markers might be different, just like your nutrient levels might be different, just like your antioxidants. So even if we eat the same food, everybody's test is unique and different. And that's what we go one further step than most people. Most people say, hey, go to a plant-based diet, everything is good, right? And most things get better, 80%. But 20%, there's a subtle nuance. But people are like, hey, I mean that you might have a food sensitivity, you might have something else. So we want to check that. But having the bowel movement, the regular, detoxification is having 2 to 3 well-formed bowel movements a day. If you can do that, no matter how much your exposure, you're actually eliminating excreting. If you're constipated, if you're eating a standard American diet, keto, paleo diet, you're not getting enough short-chain fatty acids, which is fiber, you're not producing enough NBurate in your gut, your beta-glucuronidase will be low, then the toxicity is going to be high. So sometimes we can't avoid stuff because that's just the water that we live in or area that we have, right? Or the job that we're getting exposure. But there's a way that your body can naturally just be protective, and that's predominantly through diet. But we will measure those things, and then we give recommendations based on whether we need to treat or not.
So you're located in Albuquerque. How would someone go about getting these tests if they're not?
So when they make an appointment, we actually have those testing kits shipped to them, and then they just get their blood drawn, the urine, the stool, they mail it off, and then we do all the consultations and the coaching and all via Zoom.
And then you create like a unique protocol for that particular
protocol. Yeah, because the challenge is right now, everybody when most people that see me, particularly when they see a program like this, they would come to me and they're like, I did a candida cleanse, I did a parasite cleanse or whatever, I did a detox. And I'm like, well, why? Oh, because someone told me I should do that. I go, do you have candida? Well, I think, they said everybody has parasites or everybody has heavy metals. I'm like, well, let's test it. Like, put it to the test. If you don't have that problem, then you're chelating out healthy minerals, and now you got a mineral deficiency. If you're taking an antimicrobial, even if it's natural therapies, then you're knocking out microbiome dysfunction even more because these things are not specific. A lot of people don't understand mechanism of action of pharmacology. So say, oh, I just take this herb. I'm taking this candida cleanse for 6 months. Well, guess what? It may only take 2 weeks to get rid of candida if they truly had it. And now it's kind of like an amoxicillin or antibiotic. Now we're causing microbiome dysfunction. Now they have leaky gut. Now they have more food allergies. Now they have this kind of cascading. Even though they're coming in with the right intention, Never blame them. But the idea is that there's a lot of practitioners, people who just throw programs like, you got to detox, you got to do this, got to do that. We can help anybody wherever you're at. I have patients all around the world. So we even connect in people like in other countries. We have to figure out time zones and all. But this is what people want, because as a consultant, I like to help people. Most people have a primary. Most people have 2 or 3 specialists, cardiologist, neurologist, GI, this, that, orthopedic. But our goal is to look at like, what are your meds? What are your supplements? And let's pare it down. What do you really need to eat? When we take a nutrition test, for example, it will then tell us how much of what you need. And then more importantly, what I'm going to tell you then, what are the foods you should be eating more of to get it from the diet? Food is medicine, and supplements supplement the diet. They don't replace the diet. That's why we give targeted therapies. Bosmeric is a targeted therapy. Vitamin D, for example, targeted therapy. Glucan 300 is targeted therapy. But I'm not giving vitamin C. I'm not giving vitamin A. A lot of people take all these supplements, and I'm like, no, you can just easily eat these foods today and your numbers will go up. So that's how we approach it. Sanjevni.net, they can contact us and make an appointment.
Great, thank you. And I want to ask you about supplements momentarily, but you brought up parasites, and actually just saw David Wolf having, selling some sort of like anti-parasite, supplement of some sort, and the video is horrifying, and everybody has parasites. Does everybody have parasites? And to that extent, how do you know, and what should you do about it?
So, not to get into controversy here, but
okay, you can get into some controversy.
I'm a clinical guy. I'm a science guy. I'm not a marketing guy. So people can say all they want. They can show you scary videos and make claims. They can't put it to the test. They can't show before and afters. We can show them before and after. So if someone does a parasite cleanse and they don't have parasites, then we can show dysfunction to the microbiome via testing. So to answer that question, no. To answer that question, no. And to answer that question, you need to have someone who's actually a trained clinical professional, not a fancy marketer, to tell you what to do.
So
because a lot of people follow those things, right? And if someone says like, you got to do this over and over again, then you have to look at, are they not having a good microbiome? Are they not eating a clean enough diet or plant-based diet? And are they helping themselves? That's how I look at it. And if they're not, then it's just like everybody can sell anything, right? And so like, yes, but do people have parasites? Yes. Do I get maybe 6 people a month? Yes. Right? Because they tested, they have some kind of, gut issue. Some people may not have the symptoms and test positive. I had a patient the other day. They actually had the parasite. They actually could see it on the microscope, on the lab testing, and also by PCR, which is like the DNA kind of part of it, right? Some people will say like, oh, I'm having symptoms. Like I went on a cruise, or I ate something at a restaurant. I got diarrhea a couple months ago, but it's still kind of off, and we can capture it. So some people will actually have it, but it's to say like when someone does like a live cell analysis or something like that, or whatever. We are not sterile beings, right? We have 4 pounds of over 100 trillion of over 1,000 species of microbes in our gut. We also have things that are floating in our blood. So it's not to say like, oh my God, everybody has a problem. Like, no, you have also an immune system, and there's something called biology, anatomy, physiology. But since most people don't understand that or study that and can sell you products, then it's a story that sounds good, because everybody's gonna say, well, I do feel fatigued. Yes, I do feel yes, but are they telling you should be eating a whole food plant-based diet? Are they testing your microbiome? Are they testing your food sensitivities? Are they looking at your nutritional deficiencies? No, they're selling you a program that you got to do over and over every couple of months. Right. So that the controversy for me is like, you got to demonstrate real. I mean, and that's why, I'm Dr. Pai and everybody else are social media influencers at the end of the day, when I see certain people. Right. And it's like, I'm not saying that they're bad people. They have good ideas, and people can follow what they want. But when I come to see certain people that have gone through programs, they're actually depleted over time.
Okay. And the testing that you offer that we were discussing earlier, would that include the testing for parasites, or is that something separate?
Yeah. So on the microbiome test, so I'll just give you an example. Okay. So on the microbiome test, it will test like, for example, upper to lower digestive enzyme functionings. Do people need to even have digestive enzymes or not? Right. If someone's levels are good, they don't. If someone's levels are low, they should have some. Then we'll talk about what kinds. It will look at protein, fat, fiber. Are you not only eating enough, but more importantly, are you absorbing enough? I had a patient the other day. They were trying to get more weight. They were underweight. I'm trying to, he's trying to get more weight. It's like, I'm eating. So we have to look at, like, first of all, are they getting enough? And then are they absorbing? If they have any increased intestinal permeability, which is like leaky gut, or if they have any inflammatory bowel condition, that's going to cause a malabsorption of nutrients. Right. Then we look at short chain fatty acids, which is fiber, and is it converting, and is it detoxifying? It measures all the good and bad bacteria. There's ratios of good and bad, and are you converting, all these other aspects. And then they look at mycology and bacteriology and parasites. So when they grow it out, they look at it, takes 3 weeks, and then so we'll identify it. If there's a parasite, we'll identify it. If there's a bacteria, they'll identify it, and if there's a mycology like a candida or a yeast or a fungi, they'll identify it. Then what they do, which is nice, is they test the sensitivity and resistance to natural therapies and prescription therapies. Now, I like to use natural therapies, by the way, so the lab will have like, these are the 3 natural antibiotics, for example, and here's the 5 normal common prescription drugs. But they learn then, is it sensitive, meaning it works, or is it resistant and it doesn't? What we don't do is just blanket, like most people say, you got a candida problem, take this candida product. You got a parasite problem, take this parasite product. You got a bacterial overgrowth, SIBO, this, that, take this product. But guess what? On the testing, we can show that almost half of the products now that are in the natural world have resistance. Let me say that. Half the products in the natural world have resistance. Why? Because everybody's using these things too much. Just like we overused antibiotics too much on the prescriptive side. Now everybody's going to the health store or buying online saying, I got to pre-treat my problem. Guess what? You pre-treat your problem. If you don't have that problem, just like taking too much Z-Pak all the time, the microbes then change their genetic shift and genetic drift, and then they have a resistance. So a lot of people come back and like, guess what? Your oregano is resistant. Right. Like, so people are like, oh, I've been taking oregano, whatever the product is, right? Like, I'm not, taking it, but like, and it's like, well, and sometimes people are saying, but I don't even take that stuff. Why is it, I don't need to, but guess what? The rest of the planet is taking this over and over and over. And particularly since the pandemic, everybody was taking tons of things, for prevention or worry or scare. But the idea is that we wouldn't take amoxicillin every day for prevention either, right? And people go, that doesn't make sense. That would cause damage. But when we think of natural therapies, people don't understand the mechanism of the pharmacology of how natural herbs are just the same. The only difference is it comes from a plant rather than a lab that actually derived those molecules from a plant and made it at a higher potency.
Okay, thank you for that. So going back to supplements, what are the most important supplements that you think that a person who is trying to get to optimal health on a plant-based diet should be taking?
So I always recommend the Bosmeric just because we want to lower inflammation. Even though people on a plant-based diet will be in an anti-inflammatory state, we want to do the food testing to further define if they have any inflammatory foods from a plant world. Because like I had a patient yesterday, they had a sensitivity to kale, a superfood that everybody's going to tell you to eat, right? But if she eats the kale, she will flare. Right. And this is where people get, so it could be an avocado, it could be kale, it could be a blueberry. And these are all things that are so good for us, for everyone else. And that person will take it and then they can have problems. So we want to look at from a Bosmeric because inflammation, even if you're not achy, just taking a small amount for lowering inflammation prevents aging. We're looking at slowing down the change of the telomeres, right? So inflammation like asthma, allergy, right now in Albuquerque, allergy season. So it's like if someone takes it, they have a little bit of arthritis or back pain, guess what? Their upper respiratory congestion is lesser. Why? Because that's an inflammatory response from an inhalant, like a grass, a weed, a tree, a mold, or whatever. So Bosmeric. Vitamin D, you need to make sure you're between 60 and 100 on the test. That's a simple thing for looking at immune system functioning. We will test it otherwise. Glucan 300, which is another the highest patented form. Again, clinical studies on that one. Again, looking at supporting natural killer cell functioning and lowering inflammation in the body. I look at those 3 as like kind of key. Then we look at based on the person's goals of where they're looking for or what they want to be. At the end of the day, we shift everybody in the beginning. Sometimes I give people some supplementation to change their diet, do all the testing. And then later on, we get to a level of optimum health, right? Which is where I want everybody, which is not just being like, oh, okay, I'm not having my problems anymore. It's like, you're not just drowning, your head's above water. You want to be sailing. Right? That's a level that people usually never experience, maybe 20, 30, 40, 50 years of their life. Oh, I remember a time when, right? And once we get to that level, then it's like, well, there's always a formula like, oh, I have a little problem with my vision. I'm on the computer all day, or I have a little less. Then we want to teach people like, these are certain things that you can take, and we'll give you the clinical ones, the clinical doses. Here's the data, but it's not taking a barrage of things. A lot of people like take tons of things. They come to my office. Average person has 8 to 12 prescription drugs and about 12 to 20 supplements. That's the kind of person I see, by the way. And they're not feeling good on either end. They're like, I get all these pills from my doctor in the pharmacy, and I got all these pills from my chiropractor, my naturopath, my acupuncturist, and my holistic doctor, and they still have all their 20 problems, right? So the goal is to actually look at, we're not anti-pharma, we're just anti-side effect, we're pro-patient, pro-safety, pro-data. So we want to look at what's the best of everything. And I'm really honest. I'll tell people, if you're taking a good product, you're taking the right thing, but sometimes on their test, I'll give you an example. Patient came in the other day. We did a nutrition test. She's taking magnesium. She's taking a glycinate lysine chelated complex, which is the best form. It's kind of that we actually get. So I'm like, hey, you got the right thing. But she's only taking 150 milligrams on it. And her test came back that she needs 800.
Wow.
So she's not going to get that benefit. I'm like, do you still feel achy? Yes. Your legs are cramping? Yes. All these things. Are you still constipated? Yes. Are you having trouble sleeping? Yes. It's just I'm like, you're taking the right product, but you're just not taking enough. But how will we know? We won't know unless you test. So that's where, like, even getting the guidance on dosages, because everybody might even take the right supplement. They might even do the right, most people do their research these days on some level. So they have an idea of like, yeah, I know this, but then it's like, well, what was done in the study? And then what does your body say it also needs? If we can evaluate, that's when the supplement really works well, or the food really works well, or the lifestyle chain really works well. But we have to have measurements. And then that also keeps patients more compliant. And also it makes them super happy because check off, like, hey, heart disease, diabetes, this, check. I reversed all these conditions. And it happens every day. We have patients all the time reversing heart disease, diabetes, improving their outcomes from cancer, everything.